Assalamualaikum. Anda sedang menonton Betul ke Kanser Podcast bersama dengan saya Dr Kartini. Dan hari ini adalah episod yang sangat-sangat istimewa. Tapi sebelum tu, kalau anda baru saja menonton podcast kami, ini adalah podcast khas sebenarnya untuk kita bersembang, berbincang dan mendengar cerita-cerita dan juga naratif pejuang-pejuang kanser, pengalaman keluarga mereka dan juga melihat sisipan Kanser Research Malaysia. Dan saya nak ucapkan terima kasih kepada Kanser Research Malaysia kerana memberikan sokongan yang cukup padu untuk podcast ini supaya kita boleh dapatkan informasi tentang kanser dan juga pengalaman dan juga apa research dan teknologi yang terbaru, advancements on cancer. So today I am so happy and excited kerana saya ada seorang wanita yang memang cukup gigih, cukup padu dalam penyelidikan kanser. Saya bersama dengan Profesor Sok Ching. Hello.
Hello.
She is the Chief Research Officer.
Scientific Officer.
Chief Scientific Officer Kanser Research Malaysia. Dan adalah antara orang yang paling lama lah berada di Kanser Research Malaysia. So welcome, Prof.
Thank you, Dr. Tini. It's such a pleasure and honor to be here. So terima kasih banyak-banyak.
Yes, thank you so much because you know what? I have a lot of questions in my head, especially kalau kita seorang cancer patient kan, cancer survivor. The question that I always like the first thing, and even though it's going to be about 2 years now, I still occasionally like, kenapa Why? And I heard you discovered or you are responsible untuk mengkaji kenapa sebenarnya kanser ni berlaku dalam badan manusia. Yeah, as we were talking just now. So maybe you can share a little, share a little bit about how you got into cancer research.
Yes, so first of all, terima kasihlah banyak-banyak because to include Cancer Research Malaysia and also to shine a light lah apa yang kita buat in terms of penyelidikan cancer di Malaysia, which is very important, right? So back to your question, mengapa satu sel yang normal boleh menjadi satu sel yang cancerous lah.
A rebel cell, right?
Yeah, a rebel cell or cancer cell, right? So actually that is the most important question that we ask in Cancer Research Malaysia. Kenapa? Supaya kita boleh menerajui penyelidikan yang boleh result in new treatments and new way of diagnosis, right? So the main difference we are trying to look at is apa yang ada dekat cancer cell yang tak ada dekat sel yang normal ataupun apa yang dekat sel normal yang telah hilang dekat cancer cell. So those are the things that we look at so that we can find clues mengapa terjadinya cancer. So satu sifat cancer cell adalah the ability to divide very fast, right? Or divide yang berpanjangan lah compared to a normal cell. So if we have a normal cell, sel kita tu dia memang ada finite punya lifespan. Tapi normal cell kita pun boleh divide fast dan boleh divide berpanjangan. So for example, if you cut yourself, kan the cell dia memang kena divide, kena kill supaya your wounds akan tutup and you will, your wound will heal. But in cancer, once your wound heal already, it still continue to grow and therefore it becomes a lump or a cancerous growth. So in order for the cancer cell to do that, it has to gain certain kinds of changes, what we can generally call mutation atau mutasi gene lah. So that's the main thing that happens, unfortunately, when the genes become mutated, a normal cell then becomes a cancer cell. Yeah.
So the ability untuk dia membiak lah kita panggil kan?
Ya, membiak atau grow uncontrollably.
So jadi ada tak sebab-sebab faktor kenapa dia grow uncontrollably?
So this one happens in the blueprint, right? Atau dalam, how do you say this? In the level of the gene, right? So we have normal genes that now mutated, and therefore the cell actually do not know what is normal function anymore, and it will continue to grow. So it is at the genetic and the DNA level. Yeah.
Okay. So saya sendiri nak cuba memahami kan macam manalah saya punya sel ni ada orang ada yang satu ni tiba-tiba dia nak membiak dengan pantas tu. Jadi saya sendiri akan cuba relate balik pada diri saya kan Prof, macam like is there a certain environment that I put myself in that it created this fast growing, or is it people always ask about food, it must be the food that you eat. So all these factors we try to make sense of it kan.
Yeah. I think ini memang biasalah kan untuk cancer patient. They obviously ask why me, what did I do wrong. There are certain things that we know yang memang terlibat dalam cancer. So for example merokok kan, ataupun you go out too long in the sun, UV, and you may get skin cancer. But a lot of the things, dia memang tak straightforward lah. So you cannot say that, because I didn't sleep enough, or so
I stressed out or eat this
so
or
it
that.
is not that straightforward. What is the causative factor? Apa yang menyebabkan mutasi itu? Some faktor-faktor yang kita fahami seperti rokok, UV, chemicals. Tapi in the main, it is very difficult to say this caused the cancer.
Yeah, sekadar banyak faktor yang kita
it is
perlu.
kind of like a multi-factor disease.
Yeah, so having said that, Prof, so you as a scientist kan, scientist tau, jarang-jarang nak jumpa seorang saintis yang buat penyelidikan tentang kanser, dan I feel so honoured to have you here. Jadi sebagai seorang yang memang buat kajian, memang buat research, and Prof, you yourself said that benda ni kanser ni banyak faktor kan, multiple factor. So it's like looking for a needle in a haystack. So how do you start? Where do you start? Where do we even begin to look for the answer?
So just to comment on the, it's very rare to see a scientist. So
For me lah.
no, I get that a lot, and dia memang something that I'm quite happy to be a scientist, because it's always a conversation opener. If you get on a taxi and people ask you, what do you do? And then you say you're a scientist, and people get really excited, for which I'm really, really grateful, because people really believe in science, and they believe that the work we do is very important. So thank you very much for that. So going back to your question, basically you want to repeat your question?
So just saying, just now we were saying that there's no specific reason why this cancer cell mutates in a fast manner, right? So for you as a scientist who's been doing research almost your whole career, right? Your whole life. How do you start? Where do you start? If it's not the environment, if it's maybe this factor, maybe that factor.
Okay.
So where is the core basic nak cari jawapan tu?
Right. So untuk menjawab soalan Dr. Tini, maybe I can start by starting at the end first, where we are right now. So sekarang Cancer Research Malaysia, kita memang berjaya menghasilkan satu cancer vaccine, right? And the cancer vaccine now, we are waiting to test it in patients, what we call undergo clinical trials. So maybe with that story, I will then now kind of go backwards and tell you how did we get
the cancer vaccine.
How did we get here,
So
right?
cancer vaccine ni dah boleh ambil ke?
So sekarang dia memang kita memang planning to put it in a patient, tetapi
Trial lah.
dekat keadaan clinical trial. So not like you walk into the clinic, you can get it. Yeah,
Kita
it's not
pun,
marketed yet.
kita pun tahu kan kat luar sana pun ada macam flu vaksin, COVID vaksin. So bila kata ada vaksin tu untuk kanser, itu satu kejayaan dan milestone yang sangat hebat, right?
Yeah, especially for, I mean, it's going to be the first in Malaysia, and in fact, currently there's no cancer vaccine yet that is approved for treatment. So we are all in the race to be the first.
Wow.
Yeah. So back to what your question is, which is
how do you find out about how
do you get here, right?
Yes,
so just like the COVID vaccine, if you understand, the vaccine is made with a protein, right, on the virus. So when we know the protein in the virus, then we can make a vaccine so that the immune cells now know that if you see this particular protein, you need to attack the virus.
I see.
So similarly, that's how the cancer vaccine dihasilkan lah. Maksudnya kita kena cari the equivalent of the protein on the vaccine, but this time it's a protein on the cancer cell. Yeah, and how do we do that? We do that by comparing cancers, cancer cells versus a normal cell. So like from the beginning, I was saying, the first thing you need to do is to find out apa yang ada dekat cancer cell tu yang tak ada dekat normal cell. Yeah. So about 10 years ago, my team and several other scientists discovered we found several proteins that are in the cancer cell that is not in the normal cell. Ini sangat penting kerana kalau kita gunakan protein yang ada dekat normal cell, nanti bila kita vaccinate, the immune cells is also going to attack the normal cells. Then you will have a lot of side effects, which will be very difficult, you know, to use that to treat the cancer patient. So what we did is we find things that are in the cancer cell and we study what are those proteins, right? Those proteins, do they cause cells to grow very fast? Do they give the cancer cell the characteristic of a cancer cell? And after many years of study, we found a protein that is we know sangat penting untuk the growth of the cancer cell. And when we target this particular protein, the cancer cell will stop growing. So from there, we started to create the vaccine.
Wow.
Yeah.
So this process mengambil masa selama beberapa, tadi Prof cakap 10 tahun you and your team discovered this protein.
Yes.
So it's a long and how do I say,
You
challenging
have to
journey.
be patience. You have to know how to deal with failure, right? Because in order to find, you know, the proteins we found, you have to find many, right? You have to test many before you actually find, you know, the ones that you can take forward.
Wow, congratulations. That's really, really revolutionary, right? I mean, it's really groundbreaking. So, dah bersama dengan Cancer Research Malaysia for 20 over years.
You
Prof?
mean me?
Yes, you.
Yes.
20 over years and researching untuk dapatkan vaksin kanser. Ini adalah pertama kali saya dengar. Apa lagi groundbreaking achievements ataupun benda-benda yang Prof dah jumpa sebagai seorang saintis kanser ni?
So, dekat Cancer Research Malaysia ni, kita ada ramai scientist lah. So, I mean, I'm not the only one. So, let me make it very clear. And so, this 10 years of work tu memang teamwork, and many of us, and in fact, also kita ada collaborator, you know, from Malaysia, from overseas. So, some of the things that I'm going to tell you may not necessarily just be me. So just keep that in mind, because or else it will be looking like how can one person do so many things, right? But actually, it's a huge team in Cancer Research Malaysia.
Right.
So there are some things, and kita punya research ada tiga component, tiga areas kan. The first one is the vaccine, which is basically how do we make better and more effective drugs, right? And the vaccine is one of the things that we do. The second area that we work on in Cancer Research Malaysia, and I will give you examples of all the kejayaan or Cancer Research Malaysia. But the second area that we work on is really how do we identify people who are at risk for cancer, right? So for example, some forms of cancer like breast cancer, colorectal cancer, dia memang there are some people yang ada risk yang lebih tinggi lah daripada orang ramai. And the third one is our research just make sure that, you know, in all these perkembangan, we are not leaving anybody behind. So it will be more of our outreach programs. So the first area I talk about the vaccine, so you know about that. The second area I just want to highlight that we have been analysing hundreds and hundreds of women, so women with breast cancer and you know, women who do not have breast cancer, and we were able to come up with a risk calculator, which is called Erica. So this calculator will help us determine whether a woman carry a specific mutation in a gene called BRCA. And obviously, if you have a higher risk of having this mutation, then we'll advise you to do testing and to make sure that you are aware of your risks, so that, you know, women with BRCA mutations, and they need to intensify their screening and things like that.
So you talk about cancer calculator. So bila you
Risk calculator.
So bila Prof cakap pasal calculator, mungkin lah the first thing ialah calculator yang kita kira macam tu lah. So how do you calculate if I am at higher risk or lower risk than another woman? You know?
Yes, that's a great question. And dia memang satu calculation yang a little bit complex in a way, because
not as easy as
pressing the buttons. We make it easy. That's what Erica is about. So we make it easy to understand whether you are at risk of carrying a specific gene. But let's talk about step back and talk about how do we determine whether a woman has increased risk of having breast cancer, which is basically a bit different from
other
risk of having a mutation and risk of having breast cancer. So let's go back to the risk of having breast cancer. Memang banyak faktor lah. So for example, you know, whether you have children, whether you breastfeed, and you know, age of, you know, when you got your period, all of that are quite important in terms of determining your risk. But there's also a second component, which is genetics. So for example, whether you carry certain mutations in certain genes. So we put that all together using mathematic calculations, and basically that's how we would predict a risk.
I see.
Yeah.
So it's based on questions, and then there will be some form of formula lah. Untuk menentukan yang sama ada kita ni lebih berisiko ataupun tidak. And is this already available for us to actually apply?
It will be very soon. I mean, in terms of the research, it's already there, right? And now basically we're just refining the tool and making it like easy to apply. Yeah.
Okay, so that will be something for me, itu adalah preventif lah. Kan, preventive measures, maksudnya kita tak tahu, kita mungkin belum
ada cancer
tapi kita boleh tahu sama ada kita risiko tinggi ataupun tidak melalui this risk calculator. Okay. And you sound, when I talk to you, you know, you sound so excited to share about all your work and all your research, you know.
I haven't shared about the third area yet. Would you like me to elaborate on that?
Yes.
So I talk about the...
Now say again.
I talk about the treatment, right, which is I gave an example of the vaccine, which is just one of the examples. And then I talk about the prevention part, which is the calculator. And then the third part is making sure nobody gets left behind, kan? Because kadang-kadang kita boleh menghasilkan research yang amat efektif ataupun amat inovatif, tetapi kalau tak mampu milik, susah juga, kan?
Betul.
So, or not accessible. So for example, sekarang pun kita ada chemotherapy, kita ada targeted therapy, tapi kadang-kala orang ramai yang mungkin tak kemampuan ataupun they live far away, they may not have access to all of these, right? And these are life-saving treatments that's already proven. So therefore, in terms of the third area we work on is to make sure that, we have our programs like patient navigation to make sure the women understands, are aware, and, we hold their hand in terms of going through the journey. And the second project we have is MeMoSa, which is oral cancer early detection, where we created a mobile phone app yang boleh masuk kampung, so anybody at any remote area, as long as you have an internet, we can give you access to early detection.
So in term of apps kan, application yang Cancer Research Malaysia develop, and MeMoSa is focusing on oral cancer. Yeah. Why oral cancer and not other cancers?
So basically, there are only several few cancers that are screenable, meaning that you belum ada cancer, tapi among the community, among orang ramai, we can screen you, right? So one of them is, for example, breast cancer. So you're asked to go for mammogram, right, when you hit the age of 50. So oral cancer is even easier to screen, right? And oral cancer is actually one of the screenable cancers that disyorkan lah in the Ministry of Health, right? There are 4 cancers, which are cervical, breast, colorectal, and oral is one of them. And oral cancer is actually very easy to screen. Why? You just open your mouth and say and you can actually check yourself in the mirror, right? And see whether there are any ulcers and things like that. Tapi it's easier said than done, because kadang-kala ada ulcer yang mungkin boleh jadi cancer, tapi you and I know kadang-kadang kita pun ada ulcer and within a few weeks dia akan sembuh, kan? So actually it needs a specialist to be able to tell whether certain things that happen in your mouth akan menjadi cancer ke tak. So therefore, when to answer your question, that's the reason why oral cancer is
focused as a app,
because it's screenable, right?
Dan mudah untuk kita
guna mobile phone
detect
sahaja. Using a mobile phone.
Because it's on the outer, right? Whereas kalau macam cancer-cancer lain,
kena
tumor-tumor tu
scope,
mungkin di dalam badan kita. Faham?
And secondly, oral cancer obviously is more of an Asian cancer. So 3 out of 4 memanglah berlaku. 3 out of 4 deaths due to oral cancer memanglah akan berlaku di negara-negara kita lah,
this side of the
region.
world lah. Is there any reason kenapa orang Asia lebih lebih susceptible to oral cancer than maybe our Western counterparts?
Some of it is basically due to risiko, risk habits, right? Like smoking, betel, quit chewing, and things like that. And ada pun cases yang not related to this, but we still don't quite understand it. It may be somewhat still a mystery that we are studying why certain people young and do not have risk to get cancer.
So that's the thing. Sometimes I feel that when I do my own research and I go on ChatGPT and start asking, now I can answer real life scientist. It feels that bila kita ada satu jawapan untuk satu persoalan, and then new things start coming out, right, Prof?
Yes.
Because then you say, then these other issues is a mystery. So it feels like it's going to be a continuous journey because new things will start to emerge.
It's not only new things, right? It's also evolution. For example, maybe masa dulu orang-orang dekat Asia, because they're not really exposed to ultra-processed food and things like that, so they don't, actually their cancer rates are lower, right? But nowadays it is coming up. So it's not only that new things, but actually the whole ecosystem, humans, all they are evolving. Exactly.
Globalization.
So I think kadang-kala orang pun jadi frust kan, mengapa ini tak selesai, selalu pun research. But the reality is our world is changing all the time. So we have to adapt and we have to have new things. A drug that worked maybe 10 years ago may not necessarily work very effectively now. So we have to keep up with the, the changes, like you said, modernization.
So do you think, since you did a lot of research on cells, have our body changed from from our ancestors sehingga sekarang, ataupun kita masih lagi mempunyai the main basic ones, or we have evolved as well?
I think we definitely have evolved, right? So, I mean, just to look at you and me, women, right? I mean, maybe in our mother's generation or even our grandmother's generation, a lot of women may not necessarily be working, right? They have more kids, more children, they breastfed more. So all of these actually helps make changes in our body, right? So the fact that you and I are always out in the office now, and probably both of us only have 2 kids compared to maybe 2 or 3 generations ago, then certainly those are the things that will already be very clear that our bodies are changing.
Even that is a differentiation, right?
Correct. Yeah.
How many children we are now having as compared to the previous generation, and the food that you mentioned. So memang
and the
kita berubah
environment,
lah. And is our body also coping to these changes?
Of course, we evolve at the same time. I mean, it's amazing kalau kita memang tengok the mutational rate, right, of our cells. Like actually we are bombarded. You go out in the sun, the UV will damage your cells, right? You breathe in chemicals, it will damage your cells. Actually, we have a lot of coping mechanism already in our body. And unfortunately, people still do get cancer, but currently, although we are doing a podcast about cancer, so a lot of people listening may be touched by the disease, but we forget that actually most of our friends do not have cancer. And it's because of this coping mechanism, all this repair. Kita ada workshop lah, kita ada workshop dalam body kita yang selalu repair. Macam kereta masuk garage kan.
So different people have different coping mechanism. I totally agree with you that not everybody that's exposed to a certain risk akan dapat cancer kan.
Betul.
Macam like for example, even for myself, trying to understand my own diagnosis, my elder sister is cancer. She's healthy, so which means that doesn't mean that in my family kita ada history of cancer, semua daughters atau semua anak perempuan akan dapat cancer.
Betul.
Kan? So it's like probably skip her. And then there must be a certain coping mechanism that she has that I might not have. Yeah. So it's so interesting to see like how you cannot just have a one blanket saying that if you do this, you will get it, right? Because it also depends on the individual.
But knowing that you have the risk, allows you to be proactive,
be more
lah.
aware, and having all those screenings, going for checkups, and just be open to discussion and talking about it among the family members itself. So I am so intrigued by cerita-cerita yang Prof share ni kan, dan saya rasa saya nak kena rewind balik to the beginning, which is like, why did you become a scientist? Dan as you mentioned just now, selalu dapat kalau naik taxi tu orang selalu atau Grab, mesti orang tanya you kerja apa, dapat scientist, then everybody gets excited. So what make you venture into this field, and cancer especially? You have experience going through cancer, or maybe a family member went through cancer? Why have you chosen this path?
So it's not like that, a lot of people I know were touched by cancer. So because of that, dia pun persulah satu kerjaya dalam penyelidikan cancer. But of course, I decided to do this when I was very young. I didn't really think too much about this. But certainly in my family, almost everybody studied they are very sciencey, like they are all kind of in the science area. So I was kind of automatically being influenced maybe into the science field, and I never really tak fikir lah banyak, like, oh, I'm going to be this scientist. Not at all. Actually, what I wanted to do was to really study hard and find out as much as I can. And so happened, I studied in UKM in Bangi, my first degree. And in the university, if you have first class honors, then you have an opportunity to pursue a PhD directly without doing a master's. So I thought that was quite cool. So I said, okay, I'm just going to...
Oh, so you skip masters and
Yes.
terus buat PhD?
Yeah.
First class honours. Oh.
So basically there was... No, I don't...
Fast track too, fast track,
So what I'm trying to maybe give the message to young people out there is
Yes.
sometimes it doesn't matter if you don't really know exactly you nak buat apa, right?
Right.
It's just that you just try to do the best you can and then see where that ends up. I mean, unfortunately, I do not have a very romantic or dramatic story to tell you, but that was just my path, right?
Yes,
just trying to see how far I can
No,
get.
I think that is, it doesn't have to be dramatic.
Yes.
But I think what you're saying is that sometimes we don't know where we are heading, you know?
Yeah.
And sometimes we don't know the end game. But just trust the process.
Yes.
Right? Just go with
Yeah.
it, and we find our purpose and meaning
Yes.
there.
So thankfully, at that time, bila I belajar dekat UKM, it was a very exciting era. Masa tu era technology recombinant gene. So meaning you can cut out a gene, put it in, engineer things in the cell. So I was really excited, and I had such great mentors at that time who were pioneers in Malaysia, doing this kind of work. So I was very inspired. So I pursued a PhD. And in the middle of my PhD, I again was very lucky. I was given a scholarship to go to St. George's Hospital Medical School in London. We were talking about it tadi. And I was again inspired by, very kind of forward-thinking women scientists. So I was like, okay. And actually in the middle of that, Cancer Research Malaysia ditubuhkan di Malaysia. And my supervisor here, Dr. Sheila Naden, bless her, she's really nice. She sent me an email and said, wow, you look into this, like Cancer Research Malaysia is recruiting, like you should come back, finish your PhD, quickly come back and do this. So bila I dekat London too, I applied to Cancer Research Malaysia, and straight away they said, when you come back, come for an interview. So, and the rest is history, and I've been with the organisation for 23 years now.
Yeah, that shows how passionate Prof dengan kerja dia dan dengan organisasi lah. Because when you talk about young generation these days, they don't stay for 22 years in one company. So means
You're making me sound very old.
No, I'm wisdom, loyalty, and also loving what you do. And research, saya apa yang Tini belajar hari ni ialah research takes a long time, and it's a process, and you really have to be patient. And what else is a characteristic of a scientist that what I extracted today is you have to be really patient, trust the process, and I think you mentioned just now is if you face failure, you just have to come back up. What are the things that you think
Kena suka
have?
belajar lah,
Kena suka
because
belajar,
we are always reading research papers, because we are learning from everybody all over the world, right? If somebody has done something and it works, or somebody has done something it doesn't work, so kita memang kena suka baca, belajar, and
Very thirsty.
yes, thirsty
Thirst
for
for
knowledge
knowledge,
and
yeah.
curious.
Curious,
Yeah, why
yeah.
is this happening? Like you
Right,
ask the question, why is this happening?
I'm not a scientist, but I love talking to
But
to
curiosity
people.
is one key factor, right? You see something, maybe bila buat experiment tu, you expect one result, but actually sometimes it's the results that you didn't expect that is the most interesting, right? And you have to be curious. Instead of saying my experiment failed, you have to say, wow, what is that? I didn't think of that. Yeah.
You just have to be open.
Yes.
Yeah, interesting. Great. Okay. Prof, just before we wrap up, because talking about your career as a scientist, specifically tentang cancer. How about people who are probably watching and say, how do I make that into a career? And career sebagai seorang saintis ni, macam kat Malaysia, macam jarang-jarang nak dengar. Usually our Asian parents will say, can ah, boleh ke? Can you finance yourself with such career? So maybe for someone who is doing this, maybe you can share sikit.
I think I have actually spoken to some parents, right? Because every time they know I'm a scientist, they ask me exactly that question. So, of course, it depends on, your daughter or your son, right? But I think certainly, I hope orang kat Malaysia, bila they heard about Cancer Research Malaysia, they think of us as the agent of change, or the people who will be able to change the landscape. So obviously we have many successful scientists win awards globally. I think I mentioned to you, I will be going to the American Association for Cancer Research to give a talk, and I'm really proud to say I'm bringing actually one of our young scientists who actually won an award, and American Association of Cancer Research Malaysia is going to fly her there to talk about her work in MeMoSa, by the way. So it is a real career, and if somebody is really passionate about it, I think it's worth investing in that career.
You really make a change. And untuk Cancer Research Malaysia pun adalah satu the only non-governmental organisation yang buat research pasal cancer khas untuk orang Asia, you know, because then to truly understand what makes us,
and also not for profit,
not for profit. So sebenarnya I think it sounds so fulfilling and meaningful.
Yes.
As you create that impact.
But I'm not going to lie to you, it's hard work, right? But most of the things worth doing is hard work. It's not unique to being a scientist.
I think that the challenge that you go through is makes it sweeter, makes it more fulfilling. So Cancer Research Malaysia akan menyambut ulang tahun yang ke-25 tahun ini, and as a scientist that has embarked your early career with Cancer Research Malaysia, what are the plans for the coming years? Maybe you can share, and probably your hope for Cancer Research Malaysia.
Yeah, so I think the last 25 years has been really wonderful. From setting up our organisation to tak tahulah successful ke tak, sampai now we have our own vaccine and the things that I told you about. So we are very grateful. Tapi perjalanan ini belum selesai lah kan, because we know we have so many cancer patients out there. So therefore, we hope that we continue getting the support that we have in the and more from masyarakat and all the communities in Malaysia, and the areas that we really want to pursue in the next 25 years, maybe I can divide them into 3 areas. So continue doing penyelidikan yang inovatif to bring new treatments. Secondly, ensure that kita ada access kepada treatment yang lebih baik. And finally, my own personal passion is to ensure that kita boleh empower lah the scientist muda, so that when somebody else finishes a PhD, whether in Malaysia or overseas, they think about coming back to Malaysia because we do good science here. So these are the 3 areas that I think we're going to continue pursuing and expanding, so that, for example, our programs like patient navigation dengan MeMoSa tu, sekarang kita ada centers macam 8 centers for patient navigation. The dream is to have it in the whole country. Similarly, for MeMoSa as well, and our impian kita tu memang setiap warga Malaysian tu boleh access to treatment yang lebih baik, ataupun diagnosis yang tepat,
lebih tepat, ya.
dan cepat, and mampu milik. That's the most
Alright.
important. That's what cancer research in Malaysia is all about.
Thank you so much, Prof. Just hearing about your work dekat Cancer Research Malaysia pun buatkan saya rasa safe. Saya rasa yang kita ada harapan sebenarnya kan untuk navigate through, there's a lot of people watching out there probably going through a cancer diagnosis or they've been just recently diagnosed cancer. So sebenarnya apa yang saya boleh katakan ialah perubahan ataupun treatment yang lebih baik hanya boleh berlaku dengan research, and without research then we will not be able to come up with like for example bila doktor cakap ada vaksin, itu memberikan satu harapan yang sangat-sangat besar, like which means that it is a vaccine that prevents, I don't know whether it reduces reduces the effect of getting cancer. So benda-benda ni semua berjaya dilakukan hanya dengan research. So thank you for doing all the work that you do, and I hope that in the years to come lebih banyak lagi lebih banyak lagi milestone yang Cancer Research Malaysia boleh capai dan memanfaatkan rakyat Malaysia dan juga Asia. Alright. Any last words, Prof?
Yeah, I just want to thank all the people and organizations that have been supporting Cancer Research Malaysia, and I hope more people will come on board. And thank you very much, Dr. Tini, for shining a light on what we do at Cancer Research Malaysia.
Thank you. I think we need to talk more about
Betul.
not only the journey of cancer patients and cancer warriors or cancer survivors, whatever you want to call it, but also the work that we are doing so that it feels that, if we continue doing this together, there will be a light at the end of the tunnel. There's already light, but lebih memudahkan, especially dengan penyelidikan. Alright. Thank you so much. Kan sekiranya anda rasa macam saya nak bantulah, saya pun I want to do something, I want to be a change maker, you can do support Cancer Research Malaysia. Boleh lihat website mereka cancerresearch.my. Anda juga boleh bantu dengan menjadi donor kepada Cancer Research Malaysia supaya kita boleh bantu Prof dan juga saintis-saintis lain untuk meneruskan kerja-kerja mereka dalam penyelidikan kanser. So thank you so much for watching Betul ke Cancer Podcast, dan jangan lupa untuk follow kami di social media Betul ke Cancer dan juga Spotify and YouTube. Jumpa lagi dalam Betul ke Cancer Podcast next time. Bye.